Okay, so I told you that these patients will have what? They will have diarrhea. Then another thing is personality changes, such as what? Irritability. This patient will be irritable. Patients will have agitation and mood swing. Then there will be nervousness and fine tremors of the hand, weakness, muscle aches. This patient too will have paresthesia. Then weight loss, because they are usually what? These patients are usually hyperactive, they are always moving from one place to the other. They can't just sit in one place, like a patient with hypothyroidism. Then their skin will be smooth, soft, unlike a patient with hypothyroidism. Just a moment. So can you still see my screen now? Can you still see my screen? Can you hear my voice? Can you see my screen? Because I need to be sure you are seeing my screen. So what are our nursing interventions? When it comes to patient with hyperthyroidism, you have to make sure the patient rests adequately. Then you administer what? Sedatives. Provide a cool and quiet environment because of what? Intolerance to heat. Obtain their weight daily. Then give them a high calorie diet. These patients are what? They're hyperactive. Unlike a patient with hypothyroidism who is weak, these patients are not weak. There is that excessive energy for them to move from one place to the other. So you have to provide a high calorie diet. Avoid administration of what? Stimulants. This patient are already hyperactive, so you can't you can't administer any form of stimulants. Administer antithyroid medications as prescribed. We'll get there. Administer iodine preparation that inhibits the release of thyroid hormone. Administer propranolol for tachycardia. They have high level, their BP is up. So you give them what? Antihypertensive. Prepare the gland for radioactive iodine therapy as prescribed to destroy what? Thyroid cells. The thyroid gland is what? Is overworking. Then prepare the gland for subtotal thyroidectomy if necessary, if it is prescribed. Elevate the head of the bed of a client experiencing what? Exophthalmos. If the patient is experiencing what? Bulging high, you elevate what? The head of the bed. Then there are other cares that you give to a patient with exophthalmos. The eye is exposed and is bulging. You have to make sure you irrigate the eye, you clean it, you ask them to use something to cover their eyes so that the secretion doesn't dry out. Then in addition, instruct the patient to have a low salt diet. You know the reason why. Administer artificial tears. Okay, I just finished talking about that. You administer artificial tears because this patient's the patient's eyes is bulging. So you tell them to use artificial tears, encourage the use of dark glasses. You can cover the eyes, tape the eyelids, close at night if necessary. So if they want to sleep, you can apply like a tape, highly to their eyes. Then allow the client to express concerns about the body image. With exophthalmos, these patients, they are always, their image, their self-esteem is affected. So you can tell the patient to express their concern. How are they feeling? How do they feel about it? Then another thing that we are discussing is patient teaching. So exophthalmos, great eye, we have talked about that. Eye exercise is also very important. Full range of motion, eye drops, artificial tears in the conjunctiva, so that what? The eyes will not dry out. You don't want this patient to experience any form of blindness. Dark sunglasses to avoid irritation. No massaging. They should avoid any form of massage on the eye. They can use eye patch. Then they should avoid any 5 A's that can trigger thyroid storm. Their stress is one of the A's. Then no sodium. We just spoke about it. Low sodium what? Diet. Elevate the head of the bed. I think I've spoken about it. No smoking, no stress, no form of infection. They should avoid any patient with any form of infection. Then they should avoid touching the neck. They should avoid touching their neck in case if there is a goiter or something. They should avoid touching their neck so that they should avoid touching the neck so as to avoid the release of more T3 and T4. So now, what is the complication of what? Of hyperthyroidism? The major complication we have is thyroid storm. You know, when we're talking about hypothyroidism, we talk about mixed oedema coma. We talked about what? Mixed oedema coma. But for hyperthyroidism, a patient is going to have thyroid storm. So the T3 and T4 will be produced to a level that this patient will come down with what is called thyroid storm. So what is thyroid storm? Thyroid storm is an acute and life-threatening condition that occurs in a client with uncontrollable what? Hyperthyroidism. And it can be caused by manipulation of the thyroid gland, maybe during surgery, and the release of thyroid hormones in the bloodstream. It can also occur from severe infection. It can also occur from what? When you are giving antithyroid medications. When you are giving antithyroid medication, it can cause it. Beta blockers, glucocorticoids, iodides may be administered. Antithyroid medications is one of the medications that you can use to treat it. So it is one of the medications that you can use. But when you put patients on levothyroxine and you are not monitoring the level of T3 and T4, a patient can have severely elevated level of T3 and it will result into this thyroid storm. So antithyroid medications, beta blockers, glucocorticoids, and iodide may be administered to the client before thyroid surgery to prevent its occurrence. Now, what are the signs and symptoms? All the signs and symptoms that will come with thyroid storm is also the same signs and symptoms you are going to see in a patient with hyperthyroidism, but in a more severe form. So that is just it. It will come in a more severe form. So there are interventions. You have to maintain a patent airway and adequate ventilation, administer your antithyroid medications like iodide, propranolol. You administer glucocorticoids, monitor their vital signs. You monitor continually for cardiac dysrhythmias, administer non-salicylate antipyretics as prescribed. And why? This salicylate increase free thyroid hormone level. Use a cooling blanket to decrease temperature as prescribed. What are the medical management of hyperthyroidism? The first thing is potassium iodide. Potassium iodide, what does it do? What potassium iodide do is that it shrinks the thyroid gland. It shrinks it. You know, the thyroid gland is hyperactive. Then one of the things you should know about this potassium iodide is that it stains it. So when a patient wants to take it, you tell them to use straw so that it will not stain their teeth. You tell the patient to use straw plus juice. Then keep 1 hour apart of other medication. So when patient is on this potassium iodide with other medication, you have to make sure that there is 1 hour interval. Then another one is what? Metimazole. The major thing about metimazole is that it's not safe in pregnancy, unlike levothyroxine that is safe. So please take note. Then metimazole causes what is known as agranulocytosis. And when a patient is having agranulocytosis, definitely you know that the patient is prone to what? Having infection. So you have to continue to monitor their temperature. Make sure you are maintaining septic technique. You don't want this patient to be exposed to any form of infection. Then another medication that we use is PTU, propyltaurazine. This one puts thyroid under control. It's also safe in pregnancy, but you have to tell the patient to report any form of fever and sore throat because it's also what causes agranulocytosis. Then another thing is beta blockers. Another medication is beta blockers. We all know our beta blockers. They are antihypertensive, the propranolol to lower the BP. Then radioactive iodine uptake. The patient can also undergo this radioactive iodine uptake because this destroys the thyroid gland. It destroys the thyroid cells. When they are producing in excess, that is what it does. So what are the key things you are supposed to know about this radioactive iodine uptake? You have to make sure that before the patient undergoes it, the patient has to do a pregnancy test. The patient has to do a pregnancy test. So you cannot do it for a patient that is pregnant. Ask your patient to remove their neck jewelries and dentures. You have to hold anti-thyroid medication 5 to 7 days. So if the patient has been on anti-thyroid medication, you have to discontinue it. Then before the procedure, you must put your patient on nail per 2 to 4 hours. After the procedure, the patient will be on nail per for about 1 to 2 hours. Then after, tell your patient to avoid everyone, no pregnant people because of the radioactive effect. Because of the effect of the radioactive iodine. So you tell your patient, no pregnant people, no crowds, avoid any form of maybe relative that are pregnant, no crowd, not there should be restriction. You restrict your patient. The patient cannot use the same toilet with other people because of the effect of the radioactive iodine. So you have to what? You have to tell your patient to flush their toilet 3 times anytime they use the toilet, because we don't want to affect any other people around. No same food utensils. So you have to make sure that you are isolating this patient. Give them their own utensils. Let them have their own toilet. Every equipment should be what? It should be separate, because the radiation can have effect on other people. Not same laundry as your family. So you have to make sure that you are separating them until the effect of the radiation wears off. So I hope I'm making sense. Are we still together? Okay. So now let's talk about thyroidectomy. What is thyroidectomy? Thyroidectomy simply means removal of what? The thyroid gland. And this is one of the things that can be done in a patient with what? Hyperthyroidism. So it's one of the major surgical managements. And I believe that we have managed patients with thyroidectomy before. So we have managed patients at one point or the other. So it is performed when persistent hyperthyroidism exists. When patient continues to have what? Consistent high level of what? Consistent high level of T3 and T4, then it is recommended for this patient to do what is known as what? Thyroidectomy. Subtotal thyroidectomy, removal of a portion of the thyroid gland, that is subtotal, and is preferred surgical intervention. No, so what are your preoperative interventions? You obtain vital signs and weight, assess the electrolyte level, assess for hyperglycemia, instruct the client on how to perform coughing and deep breathing exercise. You have all these, most of these are preoperative nursing care. Administer anti-thyroid medications, iodine, as prescribed. They monitor for respiratory. Postoperatively, you now monitor for what? Respiratory distress. You have to have a tracheostomy set, oxygen and suction at the what? At the bedside after thyroidectomy. Limit the way the client is talking. Assess their level of hoarseness. So you have to monitor for the level of hoarseness, because it's a sign of complication. Tell your patient to avoid flexing their neck. After thyroidectomy, a patient cannot just extend or flex their neck anyhow. There should be no stress on the suture line. Then you have to monitor for laryngeal nerve damage, because there is probability that when they are performing that thyroidectomy, there is probability for them to damage what? The larynx. And it can lead to loss of voice. So you have to monitor for what? Laryngeal nerve damage, as evidenced by airway obstruction, dysphonia, yes, dysphonia, high-pitched voice, stridor, noisy breathing, dysphagia, and restlessness. So a lot of complications can come with this laryngeal nerve damage. Monitor for signs of what? Hypocalcemia and tetany. And the reason why you are monitoring for hypocalcemia is because the parathyroid gland is located at the back of what? Of the thyroid gland. So when they are performing thyroidectomy, there is tendency that they are going to tamper with what? The parathyroid gland. So when the patient begins to come down, manifest signs and symptoms of hypocalcemia, you know that, there is a possibility that the parathyroid gland has been tampered with. Or a trauma has occurred. Now, you prepare to administer calcium gluconate if patient is exhibiting all these signs and symptoms. Monitor for thyroid storm. Following thyroidectomy, maintain clients in a semi-Fowler's position. Monitor the surgical site for edema and for signs of bleeding. Check the dressings anteriorly and at the back of the neck. Monitor for inflammation, because inflammation may lead to what? Airway blockage. Monitor the voice strength and quality, and emergency tracheostomy kits should be at the bedside. We have said this earlier on. So are we still together? Are you following? So are we still together? Okay. So our last topic for today is parathyroid gland, and even for the class, parathyroid gland. So we all know that parathyroid gland, they are pea-sized glands that are located at the back side. They are 4 in numbers. Yes, very, very tiny, like a pea size. So you can see how small they are, very, very small. So they are located at the back of the thyroid gland. And what do? They produce parathyroid hormones. That's what they do. They produce parathyroid hormone, and their function is that they control calcium and phosphorus metabolism, the level of calcium and phosphorus. That's what they do. So that's their major function. So parathyroid hormone regulates calcium level in the blood. That is what it does. It regulates calcium levels in the blood by stimulating the release of small amounts of calcium from the bone. So what parathyroid hormone does is that all it is after is increasing the blood calcium level, unlike calcitonin that lowers the blood calcium level. So it does the opposite of what calcitonin does. So parathyroid hormone is always released in response to what? Low blood calcium level. When our blood calcium is, our calcium level is low, the serum calcium level, when it is low, then the parathyroid hormone will be released, because its own function is to make sure that we have enough what? Calcium in our bone. It prevents what? Hypocalcemia. So what is done is that it will,